Hey friends, I want to talk a little bit today about what do you charge a Medicare patient once they go into maintenance care. Now, CMS does have a few things to say about this, and we're about to dive in, but in short, once a patient graduates from their active care, they are now your full cash fee.
Okay, so we see here that if you go to Medicare.gov, which is more designed for patients, but I just want to point this out. When they talk about chiropractic services, it talks about how it covers manipulation of the spine by a chiropractor to correct a subluxation. It says that Medicare does not cover other services or tests that a chiropractor orders, including x rays, massage, and acupuncture. But nowhere on this document does it really use the word maintenance care. However, we're about to see where Medicare does discuss maintenance care in their benefit policy manual. So on page 22 and rolling into page 23 here on the Medicare Benefit Policy Manual, this is chapter 15. Let me just show you this. So chapter 15, again, going down to page 22. At the bottom, this is under the chiropractic section. It's listed as maintenance therapy. So under the Medicare program, chiropractic maintenance therapy is not considered to be medically reasonable or necessary and therefore is not payable. Maintenance therapy is defined as a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition. Now, unfortunately, what I hear a lot is, but what about my elderly patients who, without their chiropractic care, again, they would deteriorate? Well, right here is proof that Medicare, unfortunately, still considers this maintenance care. So, to continue, when further clinical improvement cannot be reasonably expected from continuous ongoing care, the treatment becomes supportive rather than corrective in nature, and then it is considered maintenance. Okay, so I'm pointing this out because to me, this clearly defines what Medicare considers as maintenance care versus active treatment. We can also see here on page 31 a non-opt-out physician, which we've already discussed in a previous video, that chiropractors cannot opt out of Medicare, is required to submit a claim for any item or service that is or may be covered by Medicare. Now, we're not talking about the statutorily excluded services such as exam and x-rays here. We're actually talking about your adjustments because they can, obviously, when it's active care, be covered, where an item or service may be covered in some circumstances, but not in others. Again, when they go into maintenance care, the physician or other supplier may provide that advanced beneficiary notice of non-coverage to the beneficiary. So again, this is your ABN, which informs the beneficiary that the Medicare may not pay for the item and service, and that if Medicare does not do so, they are liable for the full charge. So be sure to issue those ABNs when the patient goes into maintenance care so that when Medicare denies that, you can go ahead and charge that patient your full cash fee for that service. Now, if you're really struggling with your Medicare billing processes and you need more help with that, check out my course on chiropractic Medicare billing at confidentchiro.com. Here, you're going to find information about the fundamentals of billing, when a patient is new, when they're in maintenance care, claims, your fees, and then all of the compliance rules that you need to know. Visit www.confidentchiro.com.